Uh, Good evening, everyone. I'm Liam Platanius. I'm the director of the Lurie Cancer Center, and I want to welcome you all to this event that we have here today, this town hall, where we hope to answer any questions that are out there about COVID and cancer, about vaccines, boosters, and to be helpful in any way we can for everyone to navigate the various questions and issues that arise. So I'm here today. I have with me Dr. Michael Ison. Michael is the chief of the transplant ID service and one of the leaders of the NewCats Institute. And he's an expert in, he has been leading our response effort to COVID in many ways. So it is a real pleasure to have him here. And what we'll do is we're gonna start with a brief update from Michael. And after that, we're gonna open it for questions so we can have a discussion. So Mike, thank you for being here.
Perfect. Well, thank you for the opportunity to chat with you today. I just thought I'd show you a couple of quick slides that just kind of set the tone for where we are. My disclosures. So first, I think is to take a look at the data, where we've come from, where we are today. And unfortunately, with this most recent third wave, we saw a very significant number of cases and hospitalizations. In fact, case numbers and hospitalizations that were far higher than our peak last summer or even the first wave. And in fact, we're about 2/3 as many as we saw during the worst wave, the third wave that we saw. At its peak, there were just around 2,000 individuals dying every single day from COVID-19. Thankfully, we've seen that the hot zones, which were in the south, have quieted down, but really it's the north that's starting to heat up. So the darker red is the areas that are having more problems. And you can see those areas that are now having to do things indoors as the weather gets colder are starting to see the number of cases going up. Thankfully, Chicago has done relatively well, as I'll show you in a minute. But again, as we move into the colder months, I think it's something that we have to be aware of. Vaccination still remains poor in certain parts of the country, particularly in the South. Thankfully, here in the Chicagoland area, it's very good. Honing in here in the state of Illinois, really you can see that our rates, thankfully, in the Chicagoland area are relatively low, much higher rates in the south of the state, again, aligning very well with where vaccine uptake is. And those areas like here in the city, where rates are relatively high of vaccination, rates of COVID-19 are relatively low. And I think we've seen a transformation in the number of people that have been admitted to the hospital. But I think it's still important to note, even with the vaccine, older adults still remain at highest risk for being admitted to the hospital, even in the setting of the vaccine. And so this is why we really need to pay extra attention to keeping ourselves safe, particularly when the COVID numbers have increased. And we've heard a lot about the vaccine, the Delta variant, and where we are. And really, I think this is our opportunity to answer questions that you may have to understand who needs to get a booster, who's eligible to get a booster, what the benefit of vaccines are, and if you have concerns because you haven't been vaccinated, how can we address those concerns? Because what we can say very, very easily is that if you look at this most recent wave and moving forward, 98 to 99% of individuals getting really sick with COVID-19 requiring hospitalization were people that were unvaccinated. And of those that die, similarly, nearly 99% of people dying are those patients that have not been vaccinated. So the best thing you can do is make sure that you're vaccinated. The other thing that I think we've learned is that it's not only important for you to get vaccinated, but all of those people around you. particularly in the immunocompromised patient population, individuals that have people unvaccinated in their household are at higher risk of getting infected than those where the entire household is vaccinated. And as we'll see in the next couple of days, hopefully shots for kids 5 and older will be authorized, and this will help increase the ring of protection around those of us that are more at risk for infection because of alterations in the immune response. You're muted.
Thank you. And I also want to add that there is a lot of confusion sometimes out there. There is misinformation from non-reliable sources. And it is so important for cancer patients and for everyone to have the correct scientific information. So we will be very happy to take questions. And I think, and we hope to have a discussion, I think one way to do it will be to post your question in the questions and answer section. I don't know if you see it in your chart, or, you know, or even in the chat section, whatever it is here. And, you know, and we can discuss. As Mike said, I think it's very important for cancer patients in particular to be vaccinated and to talk with their physicians. Of course, at any point, different, this is particularly important for some groups of patients, but let's open it to a discussion and see if we have any questions.
There is a question. Are there some cancer patients who should not be vaccinated?
Let me start this, and then Mike can finish this and correct me if I say something. I don't think so. I think every patient should be vaccinated. They need to discuss it with their doctor, should be aware. Some of the patients who have received immunosuppression may not respond as well to others, and there the booster will be even more important. But I don't think there is a specific group that should not be vaccinated. Mike, you want to continue?
Yeah, I think that that's true, that getting the vaccine for all patients with cancer is really important. If you're actively getting medications for chemotherapy, that's something that you can ask your doctor. There are some medicines, particularly those that impact the B cells, like rituximab and related medications, where we try to time the vaccine such that it's not right around the time that you get the rituximab, which will reduce the efficacy of the vaccine.
Okay, great.
Okay, a couple more questions regarding boosters. How soon after the second Pfizer shot should someone get the booster?
Mike, you go ahead.
Yeah, so it depends on what patient population you are. For people that are immunocompromised, and that includes patients that have undergone transplant, solid organ or stem cell transplant, people that are receiving active cancer therapy or stem cell transplant within the last 2 years, or still on medications to treat graft versus host disease, they should get the third dose of their vaccine at least 28 days after their last dose. If it's much longer, if you got the vaccine in March or April, now's the perfect time to go in. If you are a healthy individual and eligible for a booster dose, and these are really those individuals that are over 65, individuals that live in long-term care settings, or people that have underlying health risks or risk exposures through their job, they should be getting the booster shot at 6 months after their last vaccine.
Okay, now how about patients who had difficult reactions to the first 2 shots and now are on a chemo regime, and this patient is particularly concerned about potential side effects? Is there any advice or guidance?
Yeah, I think the one thing that we've learned is that side effects are a complication of the vaccine. The way that I look at them, they're actually a good sign. They're telling you that the immune system is responding to the vaccine, and really is not something to be afraid of. The best thing is that if you're having usually pain, low-grade fevers, chills, or kind of fatigue, you can take whatever you prefer for pain, such as acetaminophen or Tylenol, when those symptoms are present to try to get you feeling better. If you're actively receiving chemotherapy, again, it might be an opportunity to talk with your doctor to see about when's the optimal time to get the vaccine relative to your chemotherapy.
And along these, a similar conversation regarding the Pfizer vaccine has already been approved and is being administered. Do you have any update regarding approval for the Moderna vaccine?
Yeah. The meeting to discuss that at FDA is tomorrow and Thursday. And so we should have an answer, sorry, tomorrow and Friday. So we should have an answer at the end of that meeting. It will then go, just like the other decisions, to CDC the week after, where they'll make more granular recommendations, which specific patients and timing for the vaccines. But I expect that there will be recommendations for boosters in the very near future for all vaccinated individuals.
Is there the possibility to mix the booster, say you got Moderna for the original vaccine, and then are you eligible to receive the Pfizer booster?
Yeah. The current guidelines are that you should get the same booster as the initial dose. And really the evidence for giving one mRNA versus the other vaccine really aren't strong. And so there's really no advantage to switching between one of the two. There is data, some of which just came out today, looking at patients that had gotten the Johnson & Johnson vaccine and whether or not they had a better response if they got the Johnson & Johnson or one of the mRNA vaccines. There was a slight difference, but we'll have to wait and see what the FDA and CDC recommend based on that data.
What was the difference, Mike? What was the...
Yep. So in patients that got the second Johnson & Johnson vaccine, their antibodies went up about 5-fold over their pre-level, which still kept them well within the protected threshold. When they got one of the mRNA, it went up about 10-fold higher. So we definitely got a higher response with the mRNA. Both give you really protective levels, so that they may not recommend mixing and match. They may allow it. We'll have to wait and see.
Okay, that's very interesting.
So another question is, there's a patient who's 5 years post-chemo. Should that patient be looking to get a booster?
Yeah, unfortunately, with the way that the guidelines are set, is that the patients are really only eligible if they're currently getting chemotherapy. That being said, they may have other underlying medical conditions, diabetes, heart disease, and the like, that may make them eligible for the vaccine.
Okay. Switching around the topic a little bit, what are the recommendations regarding getting a flu vaccination and or COVID vaccinations? Should they be taken in a particular order, and should there be any amount of time spaced out between them?
Yeah, so this is actually probably the most important question of the day. Everyone's been so focused on COVID vaccines and on boosters that I think a lot of people have lost track of flu. And I think part of this was because last year we were very lucky, because all of us were hunkered down, kids were not going to school, so we really didn't see much flu last year. Many experts worry that there'll be an explosion of flu and other respiratory viruses this winter. We saw a big expansion of these, particularly something called RSV in kids, when they started going to camp and back to school in May and June. And so the flu vaccine remains one of the most important interventions for preventing influenza, and something that every American is recommended to get, particularly this year. When the COVID vaccines first came out, there was a recommendation that they not be given within 2 weeks of other vaccines. Now we have very good data to show that if the COVID vaccine is given the same time or separated from the flu vaccine, there's no difference in the response. And so the current guidelines say that you can get any vaccine at any interval or even on the same day as the COVID vaccine. And so my 2 cents is if you're going someplace and they can give you both the COVID shot and the flu shot, I just get both at the same time so you're done and you don't have to remember to go back. Tomorrow, for example, I'm going for my COVID booster and I'm going to get my flu shot at the same time. There's no downside to that approach.
And actually, in the same way, I got my flu shot first, and 3 days later, I got my COVID booster. So either way, there's no rule there.
It's just important that everyone receives the vaccinations. To that end, with the holiday season coming up, what is the guidance for gathering indoors, the safetiness? How safe is it, especially if there are friends and family who will not get vaccinated?
Yeah, this is an incredibly challenging situation. And what I always say is you have to look at a lot of different things. What is your risk of having a poor response to the COVID vaccine? And so people that are on a lot of immunosuppression, recent stem cell transplant, active chemotherapy, solid organ transplants, for example, even with a third dose, their response is far less than otherwise healthy individuals. And those types of people really probably should still be doing the things that they were doing before, keeping themselves protected and minimizing exposure to people that are sick, that may be sick, and that includes people that are unvaccinated. I think the other thing that you have to keep in mind is what's going on in the community. We're very lucky right now. Here in the Chicagoland area, our rate of COVID infection is incredibly low. We're below 3%, which in my mind is kind of the threshold where my anxiety goes up if it goes above 3%. And when the case rates are low, I think you can be a little bit more flexible about indoor visits, particularly if everyone there is vaccinated. If people are unvaccinated and they're coming to visit, they should remain with a mask the entire time. This means they won't be able to enjoy the meal with you because they would have to remove the mask if they are unvaccinated. If you don't have an immunocompromised patient living in the house, that's where you just have to make the risk-benefit assessment for yourself. I think it's also important to keep in mind that COVID rate, not just here in Chicago, but wherever your friends or family are coming from, if they're coming from a state that has very high rates of COVID-19, that may be someone that you just say, let's visit at a later time point when the numbers get lower where you are, because the risk of infection, even with vaccine, really relates to how much COVID there is in the area where you're at. I don't know, do you have other thoughts, Leon?
No, I was just going to say it seems that if both people are vaccinated, the chances of one giving it to the other are much less. A vaccinated person can give COVID to an unvaccinated person by being a carrier and vice versa, right? But I think the data are better than if you have two people who are both vaccinated. Of course, we should keep all the precautions if they come from area with high COVID incidents. But do you agree with that, this principle that if you have two vaccinated people, the chances of transmission of real illness are less than
I completely agree. I think, if everyone in the household is vaccinated, the risk is much lower. It just becomes more of a challenge, as this questioner asked, when someone doesn't want to be vaccinated.
And also if you have an immunocompromised patient in the house, because there the vaccination may not be enough to protect them well.
Do the vaccinations wane, and is that why boosters are being recommended?
Yeah, so the way that I always think about boosters is, first off, you have to realize there's two effects of the vaccine. Number one, it produces antibodies, and that's what protects you from getting infected in the first place. But it also generates cellular immune responses, and these what start attacking the virus if you have one of those breakthrough infections. And this is why, even if you have a breakthrough infection, the risk of hospitalization and death is so much lower in patients that are vaccinated. What we've seen is that expectedly, the level of antibody slowly declined over time in patients. This put some individuals at risk for having a higher rate of breakthrough infection. This was particularly problematic when the Delta variant emerged, where it needed slightly higher levels of antibody to protect you from the infection. The other thing that can happen, thankfully, we haven't seen this yet, but as we see the virus continue to mutate, just like the flu vaccine, it can mutate to such a point that the vaccines really don't do a good job of protecting from primary infection. And if you think about it, some flu seasons we get the vaccine right and there aren't many infections, and there are other seasons where the match isn't very good and a lot more people get infected. The good news is with the mRNA vaccines and the adenovirus vector vaccines, if that were to happen, they can develop and produce a vaccine directed at that new variant very quickly. For example, they already have an optimized vaccine for the Delta variant and the Mu variant, so the two that we're most concerned with now. So far, the data shows that the protection afforded by using one of these newer vaccines isn't much better than the original vaccine, and that's why it's still being recommended for booster doses.
But the new technology is really amazing how much more accurate and easier it will be to develop more vaccines in the future, right? So
yeah, and I actually think, I mean, we already saw Moderna has a vaccine that's COVID, flu, and RSV that looks really good, and I think that what we're all hoping is that the flu vaccine delivered by the mRNA vaccine gives us a similar response to what we're seeing with COVID-19, and again, the ability to then pull them all together very quick and very inexpensively really will help us be maximally protected about whatever against whatever virus seems to emerge.
Great. A few people have submitted questions regarding their response to the vaccine, and having recently been through treatment for blood cancer, they are not showing that they have developed antibodies. And just wondering how long until they should be tested again, and at what point will they be protected by the COVID vaccine? Yeah.
Currently, we don't recommend that people get antibody testing to determine their immune response. And this is due to a number of reasons. The tests that were produced or that are available to look at antibody responses were designed to identify patients that had an infection with COVID-19. So their level of being positive is exceedingly low and well below what would be needed to protect you from infection. And in fact, although we have a general sense of how much antibody that is needed, each test is a little bit different, and it's hard to say on test A, you need this level, test B, you need that level. Additionally, these tests only measure antibodies, and so those may be a measure of protection against primary infection. Most people have excellent cellular responses, which prevent them from getting very sick if they have a breakthrough infection. And in the end, while we would all love not to ever get infected, in the end, these vaccines were really designed to prevent people from getting sick or needing hospitalization or dying from the infection. And even over time, they have really maintained the ability to prevent hospitalization and death among vaccinated patients over time, even with the Delta virus. So really, it's not recommended to get those. And you could actually be misled with those antibodies. If you have a positive result, you may think you're protected, but in fact, the level is below what you would need to protect you from infection. And that may lead you to take the mask off earlier or take risks that you really shouldn't be taking.
But the fact also is that there are clear recommendations for this group of patients for boosters. And everybody should follow the 6 months, right, Mike? for the booster. Is that right? Yeah.
Yeah, for the what are called immunocompromised,
Immunocompromised.
active cancer, stem cell transplant, or solid organ
Solid
transplant.
organ.
They should get a third dose at least 28 days after their second dose. All others that are eligible should get the third dose at least 6 months after their vaccine, and none of that's driven by antibody response.
Exactly. So
should the booster appointments for boosters be scheduled through a patient's doctor, or are they available other places?
Yeah, we were actually talking about this beforehand. Most doctors' offices actually don't have the vaccine. These vaccines still need to be stored in -70s, and we just don't have those in most of our clinics. While some medical centers may have the ability to give the vaccine, the number of vaccines that they have in their capacity is much lower, and oftentimes far less convenient than going to your local pharmacy. And in fact, I think what we've shown with this pandemic is that the local Walgreens and CVS is not only the easiest, but perhaps the most efficient way of going on. And what I encourage people to do is if you prefer Walgreens or CVS, going to the website, they have, both of them have mechanisms where you can go identify what is your reason for getting a booster, which vaccine you got the first time, and they can tell you which pharmacy is close to you, and you can schedule an appointment very easily to go in. You can even get the flu shot at the same time you're getting the booster. So it's really easy. And, for example, there's a Walgreens across the street that gives boosters to us. So even though I come to a hospital every day, it's actually easier to go to the Walgreens across the street.
just for the record, I got my booster at Walgreens. It was fast and, it was right away over the weekend. I just went and did it. So it's no big deal.
And so
I
especially
think the only other thing I was going to say too is you don't need any documentation of your indication for getting a booster. They do want you to bring the card in with you just so that they can record it. But if you're an immunocompromised patient, they don't need you to bring your med list or anything like that. You just need to tell them, this is my condition. They won't ask a lot of questions. They'll just give you the shot.
that's helpful. Let's pivot a little bit and go back to that subject about getting together with friends and family over the holiday season. What about how safe is it to be around children who are not yet eligible to be vaccinated?
Yeah. Well, again, number one, I think this is going to change very much in the very near future. We've seen that, the data has been shown and clearly shows that the vaccine is safe and very effective in children. It's expected that this will be authorized by FDA towards the end of the month, and most experts expect that kids can be able to get vaccinated right after the beginning of November. And so by the time we get into Thanksgiving and Christmas, we should be in a time period where most kids will be able to be vaccinated. Kids less than 5 years old probably won't be able to get the vaccine until after the beginning of New Year. And again, I think the best thing that you can do is recognize that while the risk is not zero, these kids have a lower risk of infection. If they're symptomatic in any way, definitely they shouldn't be visiting, or you shouldn't be visiting with them. And much like other individuals that are unvaccinated, it's best to have them wear a mask when you're in the same space as them. I think if you want them to join you at the meal, this would be one where trying to keep them at least 6 feet away for the meal would be optimal, or if it's even an option to have things outside, that would be the best move. But I think the critical thing is get these kids vaccinated very quickly. As we've seen with this Delta wave, kids who we thought never got infected are getting infected and sometimes getting very sick from the infection.
Now, speaking of those, again, friends and family members who may have been infected in the past, Can you provide some guidance regarding conversations that we might have with people who think they cannot get infected again or cannot be carriers?
Yeah, well, the evidence is pretty clear. Just because you've had COVID doesn't mean that you're protected from infection. And we've done a large study funded by the Cancer Center to look at patients that had recovered from COVID, to look at their antibodies and cellular responses. And while they have antibodies early after the transplant, most patients, particularly those that had milder disease and didn't require hospitalization, by about 3 months, they are below the level that will protect them from infection. Further, we've seen that adding the vaccine to these individuals really does significantly increase their degree of protection, increases their antibody level, and really does help protect them. And as a result, all experts recommend that patients, whether they've had COVID or not, get the COVID vaccine. Current guidance says that these individuals should still get the 2 mRNA vaccine or a single Johnson & Johnson vaccine. This will just afford them protection over the long run. And just because they've had it definitely does not mean they're protected from getting infected again.
Okay, there are a few questions about, and perhaps Dr. Potanius, you can speak to this, about interactions and efficacy between patients who are undergoing hormone therapy and the efficacy of vaccines.
I don't think there is any, any interaction there. I think these patients should just get the vaccines and should have a good response. So for hormonal therapies, we're talking now, right? So yeah, no.
Correct.
Yeah. So I wouldn't, there's no interactions, and they should just have the vaccine.
Okay, and no evidence of blood clots or stroke or anything in any.
Not that I'm aware, there are side effects and all that stuff, but there is nothing specific that we know at this point. So I would strongly recommend for people to get the vaccine, like anyone else.
Great. There are a few questions about how soon after being infected by COVID, someone should get the vaccine if they were not yet vaccinated.
Yeah. So this depends on whether they got monoclonal antibodies. If they got monoclonal antibodies, they should not get the vaccine for 90 days. If they didn't get monoclonal antibodies, they can get vaccinated as soon as they clear quarantine, which is on average 10 days for most healthy individuals, or 20 days if patients have been hospitalized. If you're immunocompromised, this would be something to talk with your doctor about, whether or not you need any additional testing before you would be considered clear to get the vaccine. But most people, it's just once you've been cleared by the team to no longer be quarantined, you can get the COVID vaccine.
Okay. There's a question about whether the Pfizer vaccine can alter DNA.
That's a very easy one. Absolutely not. So the mRNA vaccines at no point have any DNA as part of their replication. The way that I always think of the RNA vaccines is they're a bit like Snapchat. You put the vaccine in, and in an incredibly short period of time, the genetic code, that mRNA, is gone and nowhere to be seen in your body. This is part of the reason why we have to keep it at -70. It's very delicate, and our bodies are designed to break these mRNA particles down. We produce mRNA, it's part of our normal cell cycle, and if we didn't have those mechanisms, our cells would just explode. They would keep making protein and not be able to break things down. And the protein is made from the mRNA, and after a few cycles of protein production, it's degraded by the cellular response. So there's no time that it's in the nucleus where the DNA is. Never is there DNA, and RNA can't in any way impact the DNA. So nothing's permanent with this vaccine, other than the immune response that you generate as a result of the spike protein that
And I just want to add to what Mike said. I work on, part of my cancer research is on what we call mRNA translation. And I really understand this area very well, and I can totally assure you that it does not have anything to do, it does not affect the DNA. And there are these rumors that come out here and there that create anxiety and fear, and these vaccines are very safe in that regard. They do not touch our DNA. And everything is, if you read that somewhere, this is not correct, Okay. Question?
Okay. Yes, I have another question regarding if COVID vaccines are going to become annual vaccines like the flu vaccine.
Yeah.
And will the formula change every year?
Yeah, both of those are questions that I suspect that they will be things that we need to be updated at regular intervals. What that interval is, we don't know. If you think back to January, we thought you were going to need 2 doses and be done. And then we learned that you needed a 3rd dose because of some reduction in titers and the new Delta variant to come out. I think it's important to recognize that the first person that got the mRNA vaccine is now at about 1.5 years after they got the dose. So that's the length of time that we have data on how long the antibody response stays. So this is something that I think we're just going to have to stay tuned and see what's recommended, whether all you need are 3 doses, whether it becomes an annual vaccine, and if so, if it's annual, when to give it. And that may be dependent on where you live. It may be that you need it in May if you live in the South, and then in October if you live here in the North. We'll just have to wait and see as we learn over time.
Okay, there are also a couple of questions regarding the effects on the cancer antigen 125 from the booster shot.
I'm not aware of any effects on that. I don't know how this question came all about, but at least I'm not aware. I have not heard anything about that. Mike, have you?
No, I know that there are some studies looking at, for example, PSA being transiently positive after the vaccine in a very small proportion of patients, but I've not heard anything about that signal with other cancer markers.
And all these things, like if the PSA is transiently up, that's probably some sort of cross-reactivity or something. Correct. I assume. So I wouldn't worry too much about this type of things.
The one thing that has been identified is if you do get the COVID vaccine, there are recommendations to defer breast cancer screening for a period of time after the shots, because you can get some lymphadenopathy in changes that get better. So again, if you have a mammogram scheduled, for example, around the time of a vaccine, I would definitely check with your doctor to see if that should be deferred.
And I have heard that people getting lymphadenopathy after the vaccine, some people, but that's not a bad thing then. It's a transient thing, it's a strong immune reaction. And that's why these things have to be separated. Yeah.
For those patients who have that reaction, is the booster shot still recommended?
The reaction of lymphadenopathy, definitely, the reality is, again, I think as we've said, the reaction that you're seeing is the immune system responding to the vaccine, which is exactly what you want. So it's not a sign that the vaccine is harming you. It's actually a sign that the vaccine is doing what we want it to. And so it wouldn't be a reason to not get the vaccine.
I think the question was probably if you get a strong reaction in the 2nd dose, whether you should go for the booster. But then we have the timing, right? There is a spacing between the two.
But I wouldn't let the symptoms with a prior dose stop you from getting it. And the other thing that sometimes people wonder is, well, what if I didn't get a reaction at all? Does that mean I didn't have a response? And that we clearly know that about 65% of people will have some significant reaction to the vaccine. but 95% respond. So there's a number of people that have no response or no side effects from the vaccine, but still have excellent responses to the vaccine.
And I read somewhere, Michael, I don't know if that's your experience too, that paradoxically, people who get the booster have less side effects than the second dose. I don't know if you heard anything like this.
Yeah, I definitely have heard different side effects and slightly altered. I will say personally, my first dose, I had more side effects than the second dose, and they were much more short-lived. I'll tell you tomorrow what the side effects are when I get mine. But talking to people that have gotten it, I agree, most people haven't been terribly affected.
I had more side effects in the second dose than the first, but then the booster had less. So whatever that's anecdotal.
There is a question about delaying other imaging, such as cervical lymph node ultrasound or CT, if you just had a booster, or is it just breast cancer imaging that should be delayed?
I will just, before delaying anything, I don't think we should generalize. I will talk with the oncologist and let them make the call where they know the exact case. So I will not just, delay anything on your own. I will just, for every case like this, talk with your cancer doctor and they can decide together. So I will definitely, this thing with lymphadenopathy is specific for people getting shots in the arm for the axillary node. But again, this is a very generic thing. I will not delay anything without talking to the doctor for that. For other areas, I don't think there is, the chances are much less that you will have lymphadenopathy anywhere else. So again, talk to your doctor.
Okay, and so that would be the same recommendation for a patient who's undergoing treatment and has fatigue symptoms, probably not to delay any sort of vaccination. Talk with your oncologist and come to a mutual decision.
Exactly.
Correct.
Right. I have a functional question that I'm not sure that we can answer, Northwestern specific, regarding if you get your booster outside of the Northwestern medicine system, how do you get that record onto your MyChart?
To MyChart. It goes on your card. I got it myself. I got the first two within the system, and the third one, Walgreens Center, is there. So I think, I assume, Mike, when you see your physician, right, you can, or.
Right, yeah, exactly. So the system is set up, if the place where you got the vaccine, and I would say most places are compliant with this, submit that information to something called iCare, which is the state vaccine registry. If it goes there, then it will automatically populate into MyChart. That's triggered when you have a clinic appointment. If you want it to appear there between those appointments, you'd have to ask that the team pull that in for you because it is a manual process until you have a clinic visit.
Okay, that's helpful. Let me see. There's a question about, is it accurate to test? Is there an accurate test to measure protection in the pipeline, especially for immunosuppressed patients?
There are a bunch of tests that are available, but they're not recommended for this. Part of this is that one of the most important things that we have to define is what's called the seroprotective threshold. So this tells us how much antibody you need to protect you from infection. This is only looking at those antibody levels. It's not looking at those cellular responses. It was unlikely that there'll ever be a time point that there's a level that we use to routinely test patients. If you think about your flu shot, we've never really checked your antibody response for flu. And while many people, I think, are a lot more afraid of COVID than influenza, in the end, I think the data that we have is quite strong. that even if you get a breakthrough infection, so even if the antibodies aren't high enough to protect you from infection, that breakthrough infection is very unlikely to make you terribly sick enough to require hospitalization or dying. And so again, those antibody tests may lead you to be nervous or be anxious for no good reason. And currently, no guideline, no recommendation in the United States or any other country bases a recommendation to give a booster dose based on an antibody response. It's based on time or condition.
Okay, there is a question wondering if a patient is on a clinical trial, what should they do about the vaccine and the booster?
So go ahead. Yeah.
I was just going to say, that's where you just have to talk with the doctor that's running the trial and understand what's allowed, and they're the ones that will give you the best guidance.
Yeah, talk to your doctor. It shouldn't be a major issue, but you have to talk to your doctor.
Okay. How have outcomes, severity and death improved for blood cancer patients with the Delta variant compared to studies conducted earlier in the pandemic?
How outcomes of
Yes, have they improved for blood cancer patients?
Mike, do you want to take that? Or?
So what I will say is that for all populations, including high-risk patients like cancer patients and transplant patients, have improved over the course of the pandemic. That's because we have a lot better treatments than we've had before. We have monoclonal antibodies once people first become sick that can help reduce the risk of hospitalization. Once patients are sick enough to require hospitalization, we've learned how best to treat those patients, whether it's through medication, observation, oxygenation. And so mortality has definitely decreased over the pandemic, in part because of many of the advances that we have. And so outcomes for everyone are improved. I think, though, that it still requires intervention. And so I think if you develop COVID, whether it's diagnosed by a physician here or someone else, that you alert your doctor that about this new information to determine whether or not you would benefit from monoclonal antibodies or other treatments to get you treated early.
Okay, are at-home COVID rapid tests useful and accurate?
They're amazing. We actually through the university are able to get these rapid tests. Initially, I kind of didn't think they would be terribly useful, but what I found is that they're incredibly helpful. They are, if you get a positive test for COVID, you very likely have COVID. So they're very reliable in that standpoint. If you're symptomatic and the test is negative, for the most part, you can be relatively confident that you probably don't have COVID-19. If the symptoms don't get better in a day or so, again, you should follow up with your doctor to see if there's additional testing needed, whether for other viruses or to be sure that it isn't COVID-19. If you're just doing it to see if you are infected and you're having no symptoms, that's where these tests don't do quite as well. So they may be negative and you have an infection, but aren't yet at the point that you have a lot of virus in the nose. Where they are helpful, though, is in that setting, you're very unlikely to transmit virus to other individuals for the next 12 to 24 hours. And so they are very helpful in that setting. And this is why in some settings, they're being very broadly used. They're easy to do. I've done them a couple times myself. You self-administer them. The swab is incredibly soft. The directions are crystal clear. And so they're really a useful resource. The downside is that we're in a period of time now where the number of these tests are in much more limited supply. So you may have to shop around, go to a second Walgreens to find them. But they are there and the availability will increase over the period of time, over the next couple of months, I should say.
Great. Dr. Eisen, I wanted to point out the link that you included in the chat for the audience who are seeking for more information about COVID-19. nm.org has really great resources posted.
Yeah, and then, as I just kind of typed in there too, because I saw something about someone not having their COVID card or their CDC card.
Yeah.
There's instructions at the bottom of that page for how patients through MyChart and through the web can go and print off one of the CDC cards, which documents their vaccines if they were given at Northwestern.
And I think they need them at Walgreens, so you really should print them. And then at Walgreens, they go and they add the third dose, whatever they give the booster.
Right. Different kind of tests. Are tests being developed for cellular level protection, not antibody tests?
Yeah, the problem with these is that they are technically more challenging. They require pretty fresh blood. So there are some tests that are out there. Their ability to detect meaningful responses are less than perfect. And really, again, outside of research purposes, I don't think this is going to be something that's broadly available to the general public.
They are not easy tests, and even if the research is advanced, it's very hard to imagine that they will be available for commercial use at any time in the near future.
Okay, there's a question regarding whether stem cell patients with graft versus host disease should wait to get the vaccine.
I think they should talk again to their doctor. There are many various degrees of graft versus host, and this is that's probably the most important case where you really need to have your transplant doctor on board and knowing exactly what you do. Mike?
Yeah, I agree. It really depends on what treatment you're getting for the graft versus host disease about whether to get vaccinated now or defer. But the best person to decide that is a conversation with your stem cell transplant team.
Okay, then I would say that it's probably the same answer for a patient wondering about whether they should take the booster after having CAR T cell transplant.
Yeah, definitely talk with the transplant team about, because it's especially important around the timing of this relative to the CAR T. So definitely talk to the team that's giving you the CAR Ts.
Okay, speaking of timing, for those patients who had Rituxan therapy and got the Pfizer vaccines 3 months after the end of therapy, but did not mount any antibody response, when should they get the booster? Should they wait until 6 months after the end of therapy?
Yeah. So again, this I think would be a great thing to talk with your doctor. Everyone's a little bit different because they may have paused it and they're planning to give additional therapy. So really, I think that's a great discussion with your provider. And I'll just point out, it doesn't matter whether you have a vaccine response or not. If you're eligible for a booster, then you should be getting it.
And so are there different vaccination guidelines for different cancer survivors? And this is coming from a survivor who is 11 years out from diagnosis.
It really isn't terribly different. I think the biggest thing, what we've seen is patients that mount reduced response to the vaccine are people that are actively getting chemotherapy around the time that they got the vaccines. People that have gotten a recent stem cell transplant are less likely to respond to the vaccine, and people that are on immunosuppressive medications for GVHD or other reasons have a reduced ability to respond. And so really it depends. You could be several years out from a stem cell transplant and still on immunosuppression for chronic graft versus host disease. Right. But if you've fully recovered, haven't had chemotherapy in a decade, I would just follow your other underlying medical conditions. You're less likely to be affected by the vaccine from that older diagnosis of cancer.
And
And,
again,
and congratulations that things are going well.
that's what I was going to say. If someone is 11 years out of cancer, that's really great news. And still, you can discuss with your physician, but it's very likely that we are much close to normal than anybody else.
All right, we are coming up on the conclusion of the program. There are a few more minutes for people to submit any questions that have not yet been addressed. Doctors Platanius and Eisen, are there any topics that you don't think we have covered that our audience needs to learn about?
Well, just a couple of quick things about questions that come up frequently. So one is about pregnant women. I think that this is a population that still has relatively low vaccine rates, and people are rightly concerned about the safety of these vaccines. These have been clearly shown to be safe in the pregnant woman. They're not associated with birth defects in the children that are born, premature labor and delivery, stillbirth. Any of that has been carefully studied and not increased. And really, because as we've seen in this wave, pregnant women are accounting for a large portion of hospitalizations and deaths. And so really, if you've got a pregnant family member, really encourage them to get vaccinated. Number two, get your flu shot and get a booster if it's been authorized for you. It's the most important thing to keep you healthy this winter. And then lastly, remember, vaccines are amazing. They really are our most important tool for getting out of COVID-19. But as we've seen here in the city, when COVID numbers go up, we're going to need to do more than just the vaccine. You're going to need to wear your mask. You're going to need to be careful. And while our numbers are going down and we're celebrating like we did in May, there may be another bump in the road, and we just need to be prepared, and we need to do the right thing and recognize by wearing a mask, we're protecting ourselves and protecting other individuals.
And I would say the same, and that's especially important for cancer patients receiving treatments. Protect yourself, protect others, and hopefully we will get out of this pandemic soon, although I don't want to jinx it. So we'll see.
Well, it doesn't look like there are more questions coming up onto the feed. So thanks to everyone for joining us tonight. We will follow up with a recording of our discussion via email so that you can share this with friends, family, and your networks who may not have been able to join us tonight. But thank you so much, Dr. Platanius and Dr. Eisen, for sharing your expertise and your insights. And we look forward to everyone getting healthy, getting vaccines, and being able to safely celebrate the holiday season with your friends, family, and loved ones. Thanks, everyone, and good night.
Thank you.